Hi, I'm Dr. Richard Downs, and I'm going to ask you a few questions. This is mainly geared towards dentists, and I'd like you to know that these questions are really important if you're taking any kind of imaging in your office, including x-rays and cone beam especially. So here are the questions, and I'm going to read some of them. Do you know the number one rate limiting step that inhibits stem cell mobilization and proliferation? Do you know the rate limiting step, the number one? Do you know the difference between a multi-micronutrient and a multivitamin? 3. Why would a multi-micronutrient formula purposely leave out iron, copper, and manganese? 4. Are you aware that the DNA damage that is caused by cone beam x-rays, are you aware of the extent of the DNA damage that it's causing? 5. Are you aware that there is a multi-micronutrient formula that has been proven in 14 controlled studies, including human trials, and reported in 14 peer-reviewed papers with 7 patents to protect and repair DNA damage to lymphocytes from ionizing radiation by a congressionally funded $12.5 million military grant? 6. Are you aware that there is a patent for the treatment of type 2 diabetes using a multi-micronutrient? These are really important questions, and if you don't know the answers, we're inviting you to a webinar, and it is on Thursday night at 7 p.m. Central Time, and we're going to get you the link to that. We need you to respond to this particular posting that I'm doing right now. We have a product that is simple to implement in your office to protect patients that are going through an x-ray, if they're going to have a PA x-ray or a cone beam x-ray, and we have a protective protocol for both adults and another one for children. So we'd like you to know about this and how easy it is to implement in your practice. So join us then. Thank you very much.